There are 4 questions every person who walks into every chiropractic practice has. And if the chiropractor is not focused on answering those 4 specific questions, their success will be less than optimal. And to the degree that they ignore these questions is the exact degree that they will have less than optimal success. I'll dare call it failure, okay? And in my opinion, most chiropractors are struggling because of this exact conversation. They are not paying attention to the person in front of them and their needs. What are those 4 questions that every chiropractor must answer in order to get to yes? In order for somebody to go, I understand, yes, let's do that. Question 1, can you help me? Yes or no? There are a lot of chiropractors that are not clear in their communication when they give whatever you want to call your report of finding, your recommended action plan, your here's what we should do. Most chiropractors are very vague. They're not very specific. They're not often very confident. Or they're on the other end of the spectrum where they're overly confident and they're overly specific. There's a place in the middle that is essential for chiropractors to get to in order for people to feel comfortable enough to get to yes. So we'll go through all 4, but the first question is, can you help me? Yes, I can. No, I can't. And if I can't, here's my recommendation as to where you can get help. That's an important mindset. Question 1, can you help me or not? Question 2, what's my problem? What did you find? In typical terms, what's your diagnosis? What's going on? Yes, you can help me. What's going on? I have found, and in DE Dr. Sid days, the saying was, I have found what I believe to be the underlying fundamental cause of your health concern. Okay? I have found what I believe to be the underlying cause of your health concern. That is a true statement if you have found what you believe to be the underlying cause of their health concern. That is a power statement. That is a write this down statement. Coaches for decades have been training around these specific ideas. How do you get somebody that comes into your practice with a get me out of here as quickly as possible for as little as money as I have to spend as possible? And how do you have the conversation that in fact influences them to make the right decisions, which is to pay, stay, and refer. And that's the art of communication. It's not your adjustments. I hate to say it, it's not even your results that are going to drive a referral-based practice that people come to and automatically want to say, can I lay down and will you adjust me? There is a conversation, there's information. These 4 questions are those things. 1, can you help me, yes or no? 2, what is your diagnosis? What is my problem? 3, what do I have to do about it? And 4, how much is it going to cost me? If a chiropractor is not, if any health professional, but if somebody does not have the answers to those 4 questions, they can't make a decision. They cannot make a buying decision. They can't make a scheduling decision. There's just not an information for them to go, I got it. You can help me. This is my problem. I can do that and I can afford that. And until there are procedures, there is a communication style. I don't need to call it a script as much as keeping your eye on the ball, knowing that you need to answer those 4 questions as quickly as possible, as clear as possible, in order for any person to get to, yes, let's get started. If you want to make your practice easier, more profitable, more fun, and experience more freedom, then check out Patient Pilot's weekly reactivation emails to pilot more of your past patients back into your practice. Check them out at thesmartchiropractor.com.